Now to growing concerns about the deadly coronavirus officially hitting the U.S.
China says the number of people infected by a mysterious respiratory virus has more than tripled over the weekend.
This morning, deaths from coronavirus in the United States have surpassed 160,000.
As of tonight, nearly 1 million people have died of the virus.
And that as many as 45 million of us might be killed by it.
I would like to introduce to you Dr. Richard Bartlett. He's a doctor who's been practicing medicine for over 20 years. You know, you're on the front lines of this fight. You're someone who's out there seeing it. You're not watching the news. You're in the ER. You're seeing COVID patients come in. Can you tell us a little bit about your background?
So my training is that I went to Texas Tech Health Science Center, and I actually got a degree in medical technology, my bachelor's. And in that training, we were taught virology, the study of viruses. My work has been in the emergency room as an emergency room doctor. Those are the front lines for taking care of COVID. We stabilize patients. Our goal is to take care of airway, breathing, circulation. Those are the ABCs. I'm an expert at stabilizing patients in their airway, breathing, circulation. And so when I was in the emergency room in March and I was waiting for my first COVID patient, wondering, what am I going to do if someone comes in here dying of COVID? Because there is no approved treatment. We haven't been even given an offering of something that we could give to patients. We were told, just try to keep them alive with a ventilator, and 90% are going to die. That was not acceptable to me. If my patients were going to trust me with their life, I'm going to have to do better than that. And so during that 48-hour shift, I'm praying between patients. I'm a Christian. I'm also a doctor who uses science. And a strategy came to me during that 48-hour shift of using some tools that I was already familiar with. I was looking for a stopgap measure to help me stabilize the patient. During the course of 28 years, you treat a lot of asthma. And asthma is an inflammatory disease of the lungs. And we were told from the beginning that COVID is a super inflammatory disease of the lungs. And so I connected the dots. I thought, you know, I should use this anti-inflammatory, readily available, safe medicine, budesonide. I was shocked at how good it worked. And I started seeing a pattern of some of the most difficult patients recovering. And that was against what I was seeing in the news and what I'm seeing in the numbers that are being presented. That we're having success as opposed to what's happening all around us.
So what I heard, doctor, on the news is the CDC sets the mandates and the protocols for you as a doctor of what you can and cannot prescribe. Is that true?
That's the standard. We assume that the CDC has all the answers, and so we follow what the CDC recommends. The CDC should be the final answer on every disease. They're the Center for Disease Control. It has tons of funding, lots of research, and so we assume that they know more about the diseases than we do.
Than anyone else.
Right.
And the only thing that they're mandating is late-stage treatment, is that correct?
Well, the bottom line is we're told that the only treatment plan is late-stage care. The standard was set in communist China. That's where this outbreak started. That was parroted by the World Health Organization, which is used to helping third world countries which have limited resources. And then that got touted by the CDC, late care only. But when people are dying, and I know something that's going to help save lives, this is not the time that I can stop. I have to tell the truth. And the truth is there is a strategy out of this. After I started using it, I'm having my success, but I was really kind of scared to bring it out because this was against what the CDC was recommending. They're saying don't do anything, but I'm having success.
Can you explain what budesonide actually does in the lung to the replication of this virus?
Yeah, so the virus is the SARS-2 virus that binds to these receptors in the lungs, and then it causes the release of these inflammatory chemicals that go in the bloodstream, and those inflammatory chemicals are what's killing people. But when you use budesonide, it's almost like putting a wet blanket over a fire. It decreases the release of those inflammatory chemicals. and that buys time for the body's immune system to kill off the virus. After I started getting the word out, I got this email from a nurse anesthetist of a hospital south of San Antonio. And as I was reading this, I couldn't believe it. She was saying that in their ICU, half of the people that they would take into the ICU with COVID, they'd eventually have to intubate them and transfer them to San Antonio for long-term care in the ICU. But she saw one of my interviews, and she got the hospital staff together, and they unanimously decided that they would try this treatment strategy. And once they employed it, in 48 hours, they emptied their ICU. And so there's a picture of what the potential is. Can you imagine if all the ICUs in the United States were emptied in 48 hours, what that would look like? I'm convinced that for such a time as this, I've been prepared to help with this. I have a strategy that's working at a time when we were told there's no hope. Budesonide has been out for 25 years. It's used by millions of Americans every day. We've never seen it in the news as a disaster, causing a disaster. It's been used on 2-pound premature babies. It's been used on the fragile elderly in nursing homes without any trouble. And so we know what to expect with it. It's cheap. It's about $3. It's a home treatment, saving you the risk of being in the hospital. I'm getting calls from around the country, from California to Florida, from loved ones saying that they have someone in the hospital that has COVID, and they are being told they only have one treatment option, and that is what the CDC protocol is.
Doesn't a doctor or a hospital or an institution inform a patient of all medical options available?
You know, the American Medical Association Code of Medical Ethics for all doctors is that we're supposed to tell every patient every treatment option, the risk and benefit, whether we have any conflict of interest, whether there's any financial benefit to them. And that is the code of ethics for every doctor in the United States.
Is there a way that people can find this therapy online?
There is a website called budesonideworks.com, and there's a provider tab where you can find providers there. And there's a lot of useful information there. They did put my protocol there, my treatment strategy, the therapy, and also the white paper. There's also a lot of interviews and other related research there.
I want to thank you. I want to commend your courage to stand up and to stand up for what you believe is your calling.
This is all about saving lives.
If the media companies and the people that we rely on to give us our information are not helping us getting the correct information, we the people need to stand up together and spread this word. So my call to action for anybody watching this video is share it with your friends, share it with your family. We appreciate your support. And I just want to tell you, I love you all. And I want this country to be what it should be, and I want this country to get back to where it needs to be, and I want to do my part as an American citizen to spread the truth to the world. And I encourage each and every one of you to stand up and fight for your rights. Don't let them take them from you, and know what's available.